Wonderful, thank you. Welcome to Assembly Health and Human Services. I will call this meeting to order on Wednesday, March 24th, 2021. Let's go ahead and get started. Madam Secretary, can you please call the roll?
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black.
Here.
Assemblywoman Gorlow. Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orentlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
Here.
Chair Wynn.
Here. And we are going to take things a little bit out of order. We are going to start the presentation for our Assembly Bill today, and then we are going to move to our work session after the presentation, and then kind of come back for some meetings. I know we have some scheduling errors. It's kind of that time of the session where we're going to try to get as much done as we possibly can. So I appreciate your patience on that. So if we can go ahead, and I'm going to at this time open the hearing on Assembly Bill 256. This bill provides for Medicaid coverage for doula services. And at this time, I will turn it over to Assemblywoman Summers Armstrong to begin when you are ready.
Good afternoon, Chair Wynn and members of the Health and Human Services Committee. My name is Chandra Summers Armstrong, and I represent Assembly District 6 in Southern Nevada. Today, I'm presenting Assembly Bill 256, which would enable Medicaid coverage for non-medical doula services. I am joined today by Quentin Savoy of Make It Work Nevada, Alexandra Gunter of the Reno Doula Project, and Laura, Calagridis of Thrive Wellness of Reno and the Reno Doula Project. Jolena Walker of Kijiji Sisterhood in Southern Nevada will not be able to join us today because she is attending to a patient. I'd like to start this presentation by sharing a personal story. In early 1987, I found out I was pregnant with my first child. I was living with my first husband in Fisbeck, West Germany. We were stationed at an Air Force forward operating location. The nearest military hospital was more than 2 hours away in Bremerhaven. Because of the distance, I was given the option to have my baby at a local German hospital. I didn't know it at the time, but part of the continuum of care included a midwife. Her name was Gisela Bussa. She was a stout, dark-haired, no-nonsense woman who spoke very little English. Although she had a firm demeanor, Frau Bussa exuded kindness and competence, just what this first-time mom needed to get through pregnancy and delivery while living over 5,000 miles from my mom, who would not be able to attend the birth. Our first meeting was at my house with my landlord's wife as interpreter. Frau Bussa asked lots of questions and made suggestions on room temperature, baby beds, and how much time to put the baby in the window each day to get sunlight. In the weeks before delivery, I attended Lamaze and La Leche classes at her home. She was my rock throughout the birthing process. Epidurals were not common practice there. Frau Bussa got me through the birth process with breathing, concentration, touch, and encouragement. She visited me every day in the hospital after I gave birth. I tell you this story to illustrate the difference it can make when a mom has support before, during, and after delivery. Current best practice is to have a non-medical doula providing support solely for the mom while the midwife or physician delivers and cares for the baby. I was lucky to have had an extremely skilled midwife who was able to attend me in the delivery room. If there had been any complications, her attention would have shifted, and rightfully so, to the baby and away from me. The goal of this bill is to ensure that both mom and baby have the individualized support they need throughout the entire birth process. At this time, I will hand the presentation over to Quentin Savoy of Make It Work Nevada, so that he can explain how and why his organization is engaged in advocating for this bill. Thank you.
Thank you so much, Assemblywoman, and good afternoon, Chairwoman Nguyen and honorable members of the committee. I am Quentin Savoy, Deputy Director at Make It Work Nevada. We work alongside Black women and Black families to build power for economic, racial, and reproductive justice. Part of the mission of our organization is to advocate for the health and vitality of our community members, and AB 256 is anchored in that intention. We're facing a national maternal health crisis in this country, as the United States is the most dangerous place in the developed world for an expectant parent to give birth. Let that set in. The reality is even more grim for Black women who die at a disproportionately higher rate than their counterparts. 43 Black women die every 100,000 live births. When I first learned this statistic, it devastated me. It devastated me because I couldn't help but think of all the new babies born into this world who wouldn't have their mothers. I was overcome with grief, wondering how many new Nevadans wouldn't immediately know the fierce protection, unconditional love, and comforting warmth of their mama. It didn't take long for us to find out that the national trends that we're facing as a country are particularly present right here in Nevada. We conducted field research and a series of focus groups in order to best understand the health needs of our community members. Our Black Women's Agenda Survey, a survey of more than 1,000 Black women in Nevada, discovered that more than 1/5 of our respondents reported maternal health as their most preeminent and pressing issue. We also found that 1/5 of respondents reported feeling like they had no control over their body or the decisions associated with their body. In the series of focus groups we hosted, we were able to dig a little deeper. It was in these conversations that we learned of the troubling realities that postpartum has on new parents. The women and birth parents we spoke to talked about feeling stressed, fatigued, and experienced issues with breast or chest feeding, amongst other hardships that a non-medical doula would be aptly capable of supporting a parent through. In these same conversations, nearly 1/3 of our participants reported not having access to prenatal care or prenatal services at all. Finally, these conversations with our community members revealed that doulas would be the most helpful resource during pregnancy, alongside parenting classes and resources to help with postpartum depression. Our research and conversations culminated in the pursuit of this legislation. Expanding Medicaid to provide for doula services to expectant parents and mothers is the best way to help mitigate subpar birth outcomes, ensure new Nevadan children are getting a healthy and thriving start, and serve as a cost-saving measure for our state. AB 256 is community-driven policy that at its core is about our Nevadan children. What kind of Nevada do we want to see them born into? Hopefully, it's one where we see value in their life before they even arrive. Hopefully, it's one where we ensure that the mother or birth parent has access to any and all the resources that can not only ensure a safe and healthy birth, but also ensures a postpartum period that is met with support and ease instead of trauma and stress. We can do something about this, and we should. Thank you for your attention. I'm going to turn the presentation over now to Alex Gutner of the Reno Doula Project.
Hello, my name is Alex Gunter, and I'm so happy to be here. I'm representing the Reno Doula Project from Northern Nevada. The Reno Doula Project was started in 2012 as a way to help mothers gain access to doulas. Historically, having a doula was a thing of privilege reserved for the upper class. Through the Reno Doula Project, we've been able to close this gap in access to doulas by reducing the cost through an income-based sliding scale, ensuring that women of all income levels are able to hire a doula. There is no doubt that doulas provide a necessary service. Women who have doulas attend their births have lower rates of unnecessary interventions during their labor and higher rates of birthing satisfaction. More importantly, births attended by doulas have fewer NICU admissions, higher rates of breastfeeding initiation, and a longer duration of breastfeeding. In Nevada, only 21% of our infants are still exclusively nursing at 6 months. When breast milk can be both life-saving and cost-saving for Nevadan families, we need to do anything we can to support that. In addition to the Reno Doula Project, I'm also the director of postpartum services at another doula company, Bright Heart Birth Services. Brightheart has worked tirelessly to make the role of doula a legitimate role within this field. We are not medical professionals, but we are professionals. Careful attention to scope of practice, continued training, and commitment to our clients before, during, and after labor has paved a path for doulas to be well regarded within my community. I am so happy to testify in support of more doulas at more births. This past year, the Reno Doula Project has had the honor of accepting a sponsorship from Anthem Medicaid to provide 50 of their members with doulas starting in 2021. Anthem has put their money where their mouth is, both in terms of considering doula support as a cost-saving measure and enriching service to their members. This sponsorship is an opportunity to further legitimize doulas within the field of perinatal support. People are watching us because they know what we are capable of. I thank you for your time today and ask for your support in this bill to include doula services as a Medicaid-covered benefit. Thank you. And I'll pass this on to Lauren.
Hi, y'all. My name is Lauren Calagridis, and I am a doula with Reno Doula Project, Brightheart Birth, and the Anthem Medicaid Project, as well as a perinatal psychotherapist and the program manager at Thrive Wellness of Reno, which has the only perinatal intensive mental health patient program in the state of Nevada. I'm going to share my screen briefly to share with y'all some statistics that back up some of what folks are speaking to in a narrative form. Y'all see this okay? Yep, I got some. Okay, beautiful. So I'm not going to go all the way through this, but I'm going to give us some highlights here to anchor what in the numbers of what we're actually talking about. So, for example, of the 36,000 births that happen in Nevada annually, about a third of them are performed by cesarean and about 10% are preterm births, both of which have disproportionate numbers of Black women reflected in those demographics. As far as the maternal mortality crisis that Clinton referenced, Nevada is one of the 48 states in the United States that over the last 20 years has seen a 27% increase in our maternal mortality rates. And I think of these numbers, it's important to note that in a recent year in Nevada, 2018, 76% of the deaths were people covered by Medicaid. Black and Native American women also have significantly higher maternal mortality rates than white women. In national averages, it's about 2 to 5 times higher a chance for a Black or Native American woman to die related to pregnancy-related causes than a white woman. And in Nevada specifically, Black women have been shown to be dying at rates twice as high as white women. Similarly, with the infant mortality rates, in Nevada, our infant mortality rates increased 6% between 2016 and 2018. And again, this is a place where we see a racial disparity in that Black women or Black babies are twice as likely to die than white babies nationally. Birth also represents a significant cost expenditure here. So, 61% of births in Nevada are covered by Medicaid. And of the 20 most expensive hospitalization conditions covered by Medicaid, 5 of them are related to perinatal experiences. Cesarean births are a huge piece of this in that they cost twice as much as what a vaginal birth does, representing an additional $4,500 per client who has a cesarean birth. And so all of this, doulas have been shown to meet what the Department of Health and Human Services, the National Quality Strategy, is calling the triple aim, which is not only improving health outcomes and quality of care, but also increasing cost savings. We can see some of this here. This was a Cochrane analysis that I'll point y'all to that shows that not only are doulas effective in decreasing cesarean births almost by 30%, for example, and preterm births, as well as other expensive and high-touch interventions such as vacuum extractions and epidurals, but it also increases the self-reports of clients who say that they have more positive birth experiences with doulas. And so when we factor in cost savings potential here, just factoring in the primary cesarean rates, like reducing unnecessary primary cesareans, it's reflecting at least $15 million of projected savings a year. And that's not even including subsequent cesareans, costs associated with preterm births, other high cost interventions like epidurals, et cetera. So I hope that y'all will see that there's extensive evidence that backs up this doulas as an intervention that meets the triple aim here. A recent Cochrane systemic review indicated that all women should have continuous support during labor and that there are no known harms of doula care, as well as the American Journal of Obstetrics and Gynecology that did an extensive review of 41 birth practices, and doulas were only one of 3 to receive an A grade. And so they recommended that continuous labor support, such as that provided by doulas, to be one of the most effective interventions to improve labor and delivery outcomes. And I'll leave y'all with that and with these references. And I thank y'all for your time and consideration and thinking about how this is really an intervention that serves so many purposes for the state of Nevada and the people who live here. Thank you so much.
Thank you to Quentin and Lauren, and to Alex, and also to Jolena, who could not be here. I'm just going to close this presentation with, I want to share something with you all. Let's see if I can get my screen to share. I don't know what I'm doing. Let's see if I can get this right. Bear with me, please. I am so not good at this. Okay, let's see.
This is Broadcast Assemblywoman. Did you open up your screen that you were going to share?
Yes, ma'am, I did.
Okay, and then click the green share screen button.
It is, where is it?
At the bottom of the Zoom.
Okay, now I'm really nervous. Hold tight.
No worries.
Oh boy.
So when you select the green share screen button, does it give you the option to select whatever media type it is?
It's showing me, not the...
Assemblywoman Summers Armstrong, is it possible, because you will have the opportunity to make a closing statement after the conclusion of testimony and questions, can we come back to do that, and maybe we can have broadcast services or tech come and try to aid you in that?
That is fine. Thank you so much. I'll do this after the testimony is complete, if that's okay. Once we are finishing up, that's fine.
Perfect. Do you have any other presenters, though, for Assembly Bill 250?
No, ma'am. That is it. You've heard our story, and we appreciate the time that we're allowed to do this. And I know you have to move on to some other things, so we'll sit tight and be available for questions.
Perfect. So at this time, I'm going to pause the hearing on Assembly Bill 256, and I'm going to work and move into our work session. As you know, a lot of people are moving around, presenting bills in other committees, so I want to make sure that we have all of us here when we're doing this. And I will note for the record that Assemblywoman Gorlow is now present, so we are all present in this committee. At this time, I will begin the work session on Assembly Bill 96. Mr. Ashton, can you go ahead and provide a summary of the bill and the amendments?
Yes, thank you very much. Chairwoman, for the record, Patrick Ashton, Committee Policy Analyst of the Legislative Council Bureau. Just a reminder, as nonpartisan staff, I can neither advocate nor oppose any measures that you will consider today. Members of the committee, you should have received the work session document by email, and you can also find it on Nellis. We will begin the work session with Assembly Bill 96, which we heard on March 17th. The proposed amendment to this bill will replace the contents of AB 96. Hence, I will go straight to the amendments for the sake of time. So see attached the proposed conceptual amendment for AB 96. Assemblywoman Leslie Cohen proposes to replace the contents of AB 96 with the following provisions. Amendment 1, add a section authorizing a governmental entity that licenses and regulates first responders to enter into a contract with a nonprofit organization to carry out a program to provide peer support counseling for first responders. This amendment then provides for certain requirements of such a contract as outlined in the work session document. Amendment 2 require DPPH to post on an internet website maintained by the division information concerning peer support services available to emergency response employees. And Amendment 3, require the division to collect and report certain information relating to suicide or suicide attempts by emergency response employees to the Chief Medical Officer. Madam Chair?
Thank you so much for that. Do we have any questions from committee members before we take a motion? At this time, seeing none, do I hear a motion to amend and do pass Assembly Bill 96?
So moved.
Do I have a second?
Thomas, second.
Thank you. I see a motion by Vice Chair Peters and a second by, I believe that was Assemblywoman Benitez Thompson. I'm going to give it to her. So Madam Secretary, can we go ahead and take a roll call vote?
Wait, sorry, we need a discussion.
Oh, I'm sorry. Discussion on the matter.
Thank you, Madam Chair.
And Assemblywoman Titus, go ahead.
Thank you. So although I certainly appreciate what the bill is attempting to do, I do not think that it reaches what it's attempting to do or even come close. I'm concerned that there's some duplication of services. I also feel that mandating the toll-free hotline for first responders is a duplication of services also, when we really need to be concentrating on 988 hotlines. And so for that and several other reasons, I'll be a no on this bill. Thank you, Madam Chair.
Do we have any other discussion from our members? Seeing none, last chance. Okay. Madam Secretary, can you now take a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black.
No.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
No.
Assemblywoman Krasner.
No.
Assemblyman Matthews.
No.
Assemblyman Orentlicker.
Yes.
Assemblywoman Peters.
Yes.
Assemblywoman Summers Armstrong.
Yes.
Assemblywoman Thomas.
Yes.
Assemblywoman Titus.
No.
Chair Wynn.
Yes. Having received a majority of the committee members, I find that the motion carries. At this time, we will move next to, and I will assign the floor statement to Assemblywoman Cohen. Sorry, yeah, I forgot that last time, so let me try to remember this time. Next, we're going to move on to Assembly Bill 192. Mr. Ashton, can you go ahead and summarize this bill and its amendments?
Thank you so much, Chair Wynn. One moment, please. For the record, Patrick Ashton, Committee Policy Analyst, Legislative Council Bureau. So we heard Assembly Bill 192 on March 10th. The bill requires a physician or other person who attends to a pregnant woman to examine and test the woman for certain sexually transmitted infections, unless the woman opts out of such examination and testing. I go straight to the amendments. Members, the attached Conceptual Amendment is a new version that was just provided to the committee recently. The only change to the amendment is in item 5 of the document. And you also see an updated Conceptual Amendment attached to this bill page. Amendment 1 replaces references to a laboratory approved by the State Board of Health in sections 1 and 2 of the bill with a laboratory license pursuant to Chapter 652 of NRS. Amendment 2 removes provisions requiring that certain testing be done without charge. Amendment 3 clarifies that hospital emergency departments and medical facilities must A, ask women of childbearing age whether they are pregnant, B, seek consent from the pregnant woman and commence treatment for syphilis if the blood test results show the woman is infected with syphilis and if the result is received while she is in the emergency department or medical facility, and C, indicate a case involves a pregnant woman when notifying the local health authority of a confirmed case of syphilis in a pregnant woman. Amendment 5, remove in Section 5 of NRS 442.010 the condition that a pregnant woman may solely object to the taking of a blood sample or the serological test based on the tenets or practices of her religion, thereby allowing a pregnant woman to object for any reason. Amendment 5, and this is where the actual change happened, require a health insurance provider regulated by the state of Nevada to pay for the examination and testing mandated by Sections 1 and 2 of this bill, verify that the insurer may not be required to pay more than the lowest rate prescribed by contract between the insurer and the facility, provider, or laboratory. And you see that change refers to the facility, and you can also find that in the Conceptual Amendment. Amendment 6, revise the list of other medical facilities to which the requirements of this bill apply to you, and you see in the work session document a list of these facilities. And finally, Amendment 7, clarifying subsection 1C of Section 2 that hospitals and other medical facilities must test all pregnant women who are evaluated or treated in an emergency department or other medical facility, regardless of their admission status. Madam Chair.
Thank you for that summary. Do we have any questions from committee members at this time? Seeing none, do I have a motion to amend and do pass?
So moved, Assemblywoman Gorlow.
Thank you. I have a motion to move and do pass from Assemblywoman Gorlow. Do I have a second?
Second.
I have a second from Vice Chair Peters. Do we have any discussion on the bill?
Madam Chair.
Go ahead, Assemblywoman Titus.
Thank you, Madam Chair. Unfortunately, I will not be in support of this bill. I am part of being on the interim health committee. We did address the fact that syphilis, Nevada ranks #1 in neonatal syphilis, which is not acceptable. Unfortunately, I do not feel that this bill will solve that. Unfortunately, it also may expand some other concerns that we did not see, asking that these tests be done in providers and then finding them now extending to not just labor and delivery or emergency hospital, but also psychiatric hospitals, rural clinics, mobile units that may not have that testing available on site with them, and then finding them if they don't get it. The fact that these tests can take days to get back and then holding someone liable for those just is not acceptable to me. So unfortunately, I will be a no on this bill.
Do we have any other discussion on the matter? I do know that we have the bill sponsor, Assemblywoman Cohen, present here, and I think she has a discussion on it as well, or clarifying response.
Thank you, Chair. Actually, I believe we actually, Leslie Cohen, Assembly District 29, and when this came out of interim committee, it was unanimous except for Drs. Hardy and Titus, and the concern that they had voiced was DHHS and the Nevada Hospital Association not having an agreement. In fact, they now have come to an agreement within a very short, the last little while, which is why, unfortunately, we weren't able to have a more fuller work session document earlier to you. And we actually reduced the medical facilities. We took out a lot of the medical facilities then compared to how it came out of interim. So I will just leave it at that. And then, yeah, I'll just leave it at that.
Thank you. Any other further discussion on the motion? Madam Secretary, can you go ahead and please call roll?
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black.
No.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
No.
Assemblywoman Krasner.
No.
Assemblyman Matthews.
No.
Assemblyman Orentlicher.
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
No.
Chair Wynne.
Yes. Having received a majority, the motion passes. And I will assign this floor statement to Assemblywoman Cohen as well. Next, if we could go to, I'm actually going to go back. I'm sorry, I skipped it. If we could go to begin the work session on Assembly Bill 181. Mr. Ashton, can you please summarize this bill and its amendments?
Thank you, Chair Wynne. For the record, Patrick Ashton, Committee Policy Analyst. The committee heard AB 181 on March 2nd. Before I go into details, committee members, please be advised I sent you by email an updated work session document for AB 181 recently, and it is also updated on Nellis. Assembly Bill 181 requires health insurers that provide health coverage for their employees to comply with the federal Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act of 2008. This bill also requires the State Board of Health to adopt regulations requiring certain medical facilities and facilities for the dependent to report information relating to suicide to the Chief Medical Officer. And now we go to the amendments. Dr. Woodard, Senior Advisor on Behavioral Health, DPBH, DHHS, submitted an amendment, and you see also an attached memorandum, which is titled AB 180, which is titled, AB 181 Proposed Amendment. So her amendment does, Amendment 1, it removes language in the bill requiring certain facilities to report information relating to suicide to the Chief Medical Officer. Instead, it requires certain individual providers of healthcare to provide such information to the Chief Medical Officer using the same procedures as are currently used for providing information relating to communicable diseases and drug overdoses. Next, Assemblywoman Peters proposes to amend the bill to require Amendment 2, the Chief Medical Officer to annually submit to the Executive Director of the Patient Protection Commission a written report summarizing any information relating to suicide received by him or her during the immediately preceding calendar year. And Amendment 3, and this amendment has been updated from the previous work session document that I emailed to you last night. Remove from Section 9 insurers or other organizations providing healthcare coverage pursuant to NRS Chapter 287, thereby removing those entities from any requirement to adhere to the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act and any reporting requirement prescribed in that section. Now I'll move on to the conceptual amendment provided by the Division of Insurance, which is also attached to the work session document. Amendment 4 clarified that the division will collect and aggregate but not analyze any information provided to the division pursuant to Section 9 of the bill. Amendment 5 required the commissioner to keep certain data confidential. Amendment 6 required a commissioner to annually submit to the Executive Director of the Patient Protection Commission, the Governor, and the Legislature a written report which aggregates certain information received by the commissioner. Item 7 authorized the commissioner to adopt regulations relating to the collection of certain information from certain insurers and other organizations providing healthcare coverage. And finally, Amendment 8 clarified that an insurer or other organization providing health coverage may provide a copy of a required federal report to the commissioner that demonstrates compliance with the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act. And the commissioner may request supplemental information from these entities if the federal report does not fulfill all the mental health parity requirements set forth in federal law. Madam Chair.
Thank you. Members of the committee, do we have any questions? I know that we have Assemblywoman Peters here. I think she would like to make a statement just about the work session document and some of the amendments that are there. So Assemblywoman Peters, go ahead.
Thank you, Chair. This was really a group effort and then attacking the issues on both sides of what is the most important piece, the patient. And I just want to thank all of the stakeholders who worked with me on this in and out of the last couple of weeks and beyond. I did want to clarify that in the proposed amendment that was proposed by myself to remove the NRS Chapter 287 reference in Section 9 really doesn't affect the bill's efficacy. It just comes into and in line with the Parity Act, which already exempts those programs anyways. So I just wanted to clarify that.
Question, Madam Chair, if I might.
Go ahead, Assemblywoman Titus.
So thank you for that, Assemblywoman Peters, for the clarification. But I also have, I need a little bit of clarification on, if I'm looking at your amendment, I think that was suggested by Dr. Woodard, and I'm not sure we're all looking at the same amendment. The one that I have has suggested language that the green text, and it removes, there's a lot of stuff being removed, but then it looks like we're moving existing language from another NRS, 441A.120, the board shall adopt regulations to control communicable diseases. I believe the board already has regulations. So is that new statute? Because it's in green, so that would be new wording. In that, it also talks about adding then the green stuff about this, the blue, and then about adding suicide statistics. So are we changing where that chapter is? Because the language looks familiar. But it's in green, so it looks like new language.
I appreciate
I think I can address that question. Oh, I'm sorry.
No, that's great. I was just going to say, I believe you have Dr. Woodard on the phone who can address that question.
I'm happy to address it as well, however you prefer.
It doesn't matter to me. I'm sorry. I thought that was Dr. Woodard who was speaking.
I think everyone was speaking. Why don't we go ahead and start with Dr. Woodard?
Sure. Thank you, Chair. Stephanie Woodard for the record. To be clear, the conceptual amendment was really not intending to change existing reporting requirements under that section of existing statute, but was to add into that same area of language the reporting requirements for suicide.
And Ms. O'Krent, do you want to further clarify if that's, or confirm, I should say?
Carly O'Krent for the record. That's correct. I think that the green language in 441120 is existing language, but we've simply added this new requirement that will go in that same chapter.
Okay, thank you.
Do we have any further discussion on the matter? At this time, I'll entertain a motion. I see a motion by actually Assemblywoman Benitez Thompson and a second, it looks like, by Vice Chair Peters. Any further discussion on the motion?
Madam Chair?
Go ahead, Assemblywoman Titus.
Thank you, Madam Chair. Unfortunately, I'm going to be a no on this bill. I think that there's a lot of language in here that's appropriate but premature and hasn't been really vetted. And the consequences of this language when we never did get a straight answer on a certain timetable, and I, as a provider, have concerns about possible suicide attempts versus accidental overdoses. I understand what we're trying to achieve. I think this bill does not do that, and it may add extra complications with false information and false reporting. So I will have to be a no, sorry.
Any other further comments on the motion? Seeing none, we'll go ahead, Madam Secretary, can we please do a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black.
No.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
No.
Assemblywoman Krasner.
No.
Assemblyman Matthews.
No.
Assemblyman Orentlicker.
Yes.
Assemblywoman Peters.
Yes.
Assemblywoman Summers Armstrong.
Yes.
Assemblywoman Thomas.
Yes.
Assemblywoman Titus.
No.
Chair Wynn.
Yes, having received a majority, the motion The motion carries. At this time, we will move on to our next Assembly bill, which is Assembly Bill 197. Mr. Ashton, please summarize the bill and any potential amendments.
Chairwoman, just a question for AB 181. To whom would you like to give the floor statement, please?
Sorry, if we can assign that to Vice Chair Peters.
Thank you very much. And excuse me, with which bill did you want to continue?
I'm sorry, Assembly Bill 197.
Thank you very much, Chairwoman. For the record, Patrick Ashton, Committee Policy Analyst of the Legislative Council Bureau. Assembly Bill 197, we heard this bill on March 17th, and it authorizes a minor who demonstrates through documentary proof that he or she is living apart from his or her parents or legal guardian to consent to certain health examinations or services provided by certain providers of health care for himself or herself or his or her child. The bill removes the requirement that a minor must have lived apart from his or her parents or legal guardian for a period of at least 4 months. This bill also revises provisions that require the state registrar to provide birth certificates to a homeless person free of charge in certain circumstances. And then Assemblyman Watts proposes the following amendments to Section 1 of the bill. Amendment 1, replace mother with parent in subsection 1C of NRS 129/30. And Amendment 2, replace in a physician's judgment with in a judgment of a provider of healthcare in subsection 1D of NRS 129/030. Additionally, Joanna Jacob, Government Affairs Manager of Clark County, proposes an amendment. Amendment 3, revise the bill to add child welfare agencies acting as a custodian of a child with the intention to treat child welfare agencies the same as a parent or legal guardian. And please see also the attached proposed amendment. Thank you, Chairwoman.
Thank you for that summary of the bill. I know that we also have the bill sponsor here, Assemblyman Watts, and I appreciate everyone's patience. As you know, a lot of these bills came out not necessarily representing the intent that I think some of the presenters assumed they would be. So there have been quite a few amendments, and they haven't been drafted in their formal form yet. So we do have Assemblyman Watts here, and I believe he wants to make a statement regarding the bill as well. So go ahead, Assemblyman Watts.
Thank you very much, Madam Chair. I just wanted to thank Assemblyman Orentlicker and Assemblywoman Titus, whose suggestions led to the changes in the proposed amendments 1 and 2. I also wanted to note briefly, I know that there's been questions from some of my colleagues about what impact this may have on consent for abortion care. And a legal opinion was provided that says, because Nevada's existing parental notification statutes remain facially unconstitutional, a minor in Nevada has an existing constitutional right to obtain an abortion under NRS 442.250 without parental consent if the minor gives informed consent under NRS 442 and 442.253. Assembly Bill 197 does not affect such an existing constitutional right. If in the future a minor does not have such an existing constitutional right, for example, if the state were to adopt parental notification requirements that are constitutionally permissible, then under that hypothetical scenario, AB 197 could potentially have some sort of impact. But as things stand right now, it would have no impact on the ability of minors to seek abortion care with or without the consent of the parent. So I just wanted to make sure we got that on the record.
Thank you. And do we have any questions before the motion from committee members?
Question?
Go ahead, Assemblywoman Titus.
Thank you, Madam Chair, and thank you, Assemblyman Watts, for that clarification and the additional language. I have a question regarding the amendment proposed by the Clark County and some clarification on that particular amendment. The way I'm reading it says a parent or parents of legal guardian or custodian. of a minor who receives an examination of services are not liable for the payment for that exam. And so I'm wondering who is liable for the exam? Who does pay for the cost of services? Who will be held accountable?
For that question, Assemblywoman Howard Watts for the record. I would defer to Clark County if they're available to answer that question. Again, it's just adding, the intent that they provided during the hearing was adding parity between custodians along with parents and legal guardians under existing statute.
And we have Ms. Joanna Jacob here to be able to answer that question. Go ahead, Ms. Jacob.
Thank you, Madam Chair, and to you, thank you, Assemblywoman Titus. I think Assemblywoman Watts summarized our intent very astutely. It's not that the intent of adding that is to treat, like in that subsection 7, the parent would not be liable for the cost if they did not consent. The guardian would not be liable for the cost of that consent of care if that was not consented to. I think that's a situation, I can see why that's the public policy that's proposed here. And so we were just asking for parity in that sense. You know, Clark County Child Welfare does try to cover the costs for care of the children who are in our custody. So we do make all efforts to do that. But we do have situations where we have runaways and we have things that we try to work with Mr. Garfuri and the bill proponents behind this. We're hoping that this is a very few occasions where this will have to be invoked. But the intent is just to treat us just as a parent or legal guardian. The definition that is in the amendment 432B060 for custodian is actually defined as a person or a government organization other than a parent or legal guardian. So it's just recognizing that legal status of the custodian when we have legal custody of the child. I hope that addresses the question.
Follow up, Madam Chair. So the reason, and thank you for that, Ms. Jacob. I appreciate. I know that your heart is in the absolute correct spot here. I'm just wondering. I was surprised to see it here now because the purpose of the bill, from what I see, is really addressing when the minor doesn't have a parent, a guardian, or a custodian, because then if they have those, they give the consent for treatment, and that this bill doesn't really address this particular section of then who's going to pay for that if the parent, legal guardian, or custodian does give authorization. So we don't need this bill if they've gotten authorization. So I'm just wondering where that showed up in this bill.
Thank you. If I may, Madam Chair, Howard Watts for the record. I just want to note that this amendment was presented during the original hearing for the bill, and there were no questions on it at that time. And this justification for the amendment was provided then. And the situation that Ms. Jacob has described is particularly a runaway situation. So again, if the child is under the care of the custodian, then this would not apply. It's if the young person has run away and is homeless and is not currently under the care of a parent, guardian, or custodian.
Madam Chair. Thank you, Mr. Watt.
Any other further questions from the committee? Seeing none, I'd entertain a motion at this time.
So moved.
I see a motion from Assemblywoman Benitez Thompson. Do I have a second?
Second.
I have a second from Assemblywoman Gorlow. Madam, do we have any comments on the motion?
We do, if I might, Madam Chair.
Go ahead, Assemblywoman Titus.
Thank you, Madam Chair. I absolutely appreciate what this is trying to do and get healthcare, having been in emergency rooms so many times where I could not treat a child that shows up with a broken arm or an injury until I got parental consent. But at the same time, there are some concerns that we have regarding this bill with the question that we asked of our legal counsel and some other concerns regarding parental rights. And so for that reason, unfortunately, I'm going to have to be a no.
Do I have any other further comments on the motion? Seeing none, we can go ahead and, Madam Secretary, please do a roll call vote.
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black,
No.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
No.
Assemblywoman Krasner,
No.
Assemblyman Matthews,
No.
Assemblyman Orentlicher,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
No.
Chair Wynne.
Yes. Having received a majority, the motion carries. Next, if we can move to Assembly Bill 217. I'm going to skip 216 and go to 217. Mr. Ashton, can you please summarize the bill and its amendments?
Thank you, Chair Wynne. Just a question regarding AB 197. Who will you assign the floor statement to, please?
I keep doing that. I see Assemblyman Watts still on here, so if we could assign that to Assemblyman Watts. If he is not available, can we make Assemblywoman Summers Armstrong the backup?
Thank you so much. Next, we'll move to Assembly Bill 217. For the record, Patrick Ashton, Committee Policy Analyst, LCB. AB 217 requires the administrator or other person in charge of designated medical facilities, facilities for the dependent, and other licensed facilities to ensure that each unlicensed caregiver at the facility completes certain training, including training on the topic of the control of infectious diseases. The measure requires the State Board of Health to adopt certain regulations prescribing such training. And for the sake of time, I leave out the rest of the document, and there were no amendments, Chair.
Thank you. I also have Assemblywoman Cohen here. Do you have any further statements to make on this bill?
Thank you, Chair. Yes, Leslie Cohen, Assembly District 29. Just some information. This bill came out of the interim committee unanimously. I don't have any amendments, but there have been some stakeholders that did request that some information be put on the record. Even though some of it was addressed at the hearing, I'll just quickly go through that. So just to be clear, when we're talking about the unlicensed workers here, we are not talking about friends and family caregivers. There is some language and some statutes having to do with that. But they are not an issue here. Additionally, to be very clear, it is the intent of this bill that the training be for no cost or a minimal cost. And then also, it is also the intent of the legislation not to add extra training hours, but to help DHHS to prioritize trainings to make sure unlicensed caregivers are given focused training based upon the most recent surveys and citations available. That's not saying that the board can't add extra training hours if they believe it's necessary, but we're not looking to duplicate any training that people are already receiving. So thank you for that, Chair.
Do we have any other questions from the committee? Seeing none, do we have a motion? Sorry, I see a motion from Assemblywoman Benitez Thompson. It looks like I have a second also from Vice Chair Peters. Do we have any comments on the motion? I see a comment from Assemblyman Hafen. Go ahead when you're ready.
Thank you, Madam Chair. I appreciate the bill sponsor bringing this forward for the interim committee. However, I still have concerns over who's going to be covering this additional training, and therefore at this time I will be a no.
Do I have any other comments from committee members on the motion? Madam Secretary, at this time, can we do a roll call vote?
Assemblywoman Benitez Thompson?
Yes.
Assemblywoman Black?
No.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
No.
Assemblywoman Krasner,
No.
Assemblyman Matthews,
No.
Assemblyman Orentlicker,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
No.
Chair Wynn.
Yes. Having received a majority, the motion carries. At this time, I would like to assign the floor statement to Assemblywoman Cohen. If she's not able to, I would assign it as a backup to Assemblyman Ornlicker. At this time, if we can move to our next bill on work session, I'm going to kind of go back up to Assembly Bill 216. Mr. Ashton, can you please summarize this bill and its amendments?
Thank you, Chair Wynn. For the record, Patrick Ashton, Committee Policy Analyst. AB 216 requires the Director of the Department of Health and Human Services to include in the statement for Medicaid coverage for cognitive assessment and care planning services for persons who exhibit signs or symptoms of cognitive impairment. And we heard this bill on March 15th. Ina Schmidt, Administrator of the Aging and Disability Services Division, proposes the following amendments to the bill, and see also the attached amendment. Amendment 1, a revised subsection 1 to state that a person who experiences signs or symptoms of cognitive impairment, instead of a person who exhibits them, shall be included in the state plan for Medicaid coverage for cognitive assessment and care planning services, with the intention to ensure self-reporting patients or caregivers are not precluded from these services. Amendment 2, remove subsection 2D, judgment as it relates to safety awareness, from the division of cognitive impairment to align it with medical terminology. Additionally, clarify that a person may have any one or all of the deficiencies outlined in this subsection. Assemblywoman Titus proposes the following amendment to Section 1, and see also the attached Conceptual Amendment. Amendment 3, revise subsection 2 to exclude from the definition of cognitive impairment any condition with temporary or reversible effects. Madam Chair.
Thank you. At this time, do we have any questions from members of the committee? Seeing none, do I have a motion to amend and do pass? 216.
So moved.
I have a motion by Assemblywoman Titus. Do I have a second?
Second, Black.
I see in a second from, I think that was Assemblywoman Black. Do we have any discussion on the, or any comments on the motion?
Madam Chair.
You guys see Assemblyman Hafen? Go ahead.
Thank you. I just want to take the opportunity to thank the bill presenter for reaching across the aisle and really working with everyone to get this bill to a place where we could all support it. So I just wanted to say thank you.
Thank you, and I'm sure Assemblywoman Gorlow appreciates that. Do we have any other comments on the motion? Seeing none, Madam Secretary, can we go ahead and do a roll call vote?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
Yes.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
Yes.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
Yes.
Assemblyman Orentlicker,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
Yes.
Chair Wynn.
Yes. The motion passes, carries, and if we can assign this floor statement to Assemblywoman Gorlow. And finally, if we can go to our last bill, Assembly Bill 228. Mr. Ashton, please summarize the bill and its amendments.
Thank you, Chair Wynn. For the record, Patrick Ashton, Committee Policy Analyst, LCB. So we heard Assembly Bill 228 on March 17th. It provides for the establishment of children's advocacy centers and requirements governing the credentialing and operation of such centers are specified in the bill. The bill also requires the governing body of each county and each child welfare agency to ensure that children who are victims of abuse or neglect have access to a multidisciplinary team through a children's advocacy center, and it creates the account to support children's advocacy centers in the state general fund. Amendments. Jesse Hort, the chair of the Legislative Task Force from the Children's Advocacy Centers of Nevada, proposes the following amendments, and see also the attached proposed amendments. Amendment 1, revise subsection 1B of Section 6 to clarify that a Children's Advocacy Center must operate in accordance with the standards prescribed by the National Children's Alliance to the extent these standards do not conflict with federal or state law. Amendment 2, clarify in subsection 4 of Section 6 that children do not have to be victims of abuse or neglect in order to access services of a Children's Advocacy Center. Also clarify that access to services are not limited to a multidisciplinary team. Amendment 3, revise the bill to ensure all child welfare information can be shared with every member of a multidisciplinary team to support a child's case, including cases with allegations of sexual assault by a child's relative who is not a caregiver. Next amendment is from the Nevada Justice Association. Amendment 4, revise Section 6 to provide that a member of a Children's Advocacy Center's multidisciplinary team is only immune from civil liability for any communication within this team. The immunity provisions in the bill for an employee or officer of a Children's Advocacy Center are not modified by this amendment. Assemblywoman Brittany Miller proposes the following amendment to Section 6, Amendment 5, revise subsection 3 to make available by court order confidential information maintained by a Children's Advocacy Center pursuant to the subsection. Madam Chair.
Thank you. And I believe we have Assemblywoman Miller here to, I think she has some comments to make regarding some of the amendments that were recently added. So Assemblywoman Miller, go ahead when you're ready. We can't hear you.
Thank you. Yes, Chair. Thank you so much. I just want to thank everyone involved. All of the amendments are friendly after a lot of hard work that went in with multiple parties. So the amendments are friendly, and there will be one more amendment submitted, but that amendment will only be to add additional signers. So I knew that that wouldn't hold up the work session process, but I will give that to the committee.
Thank you. Do we have any other comments? It looks like we have one from Assemblywoman Titus. Go ahead.
Thank you. I have just a question, and thank you, because I do support, again, this concept, and I think it's important, and I appreciate all bodies reaching out, and it was very excellent advocates on this bill. My question, though, seeing this one from the proposed by the Nevada Justice Association, Section 6, number 2, where an employee or officer of a Children's Advocacy Center or a member of multidisciplinary team is immune from civil liability for any action or mission if they're in good faith. You're striking that out and only going to give them civil liability protection for an intra-team communications made. Is there statutes anywhere else that would give somebody that's in their best interest trying to do the right thing for these kids immune from civil liability? Are we opening up a potential litigation avenue for this Nevada Justice Association? I have concerns now that I'm seeing this amendment.
Right. Thank you for the question. No, we're not. What it actually is limiting, because and that's where the word intra comes from, so that the people that are within the actual advocacy team are protected. It's when we start going outside, say, for instance, if we brought in another social service or another agency or even licensed healthcare professionals who all are covered under their own protection and insurance as well. So what it was to rein it in on, because again, the challenge of the definition of good faith covers a multitude of things, but it was to keep, we want everyone in the Children's Advocacy Center to be protected, to do the reporting that they need to do, to have the privileged conversations and communications that they need to do, unless by court order, but to make sure that it's specific to those that are trained and working within this multidisciplinary disciplinary team. So I hope that
well, as a teacher, you're a mandatory reporter for certain things. And as a physician, I'm a mandatory reporter for certain things. And if I do it in good faith, I'm protected from that family. Then I report because I suspect child abuse. I report that. But I do it in good faith because I see a broken arm in the ER. Turns out it's, I report it, mandatory reporting. They go back and say, you accused us of being child abusers. It's not true. I'm protected because I did it in good faith. I just want to make sure that folks who work at the Advocacy Center and that team are protected. So I just needed some clarification on that. Thank you.
Yes, and thank you for that, Doctor, because that's exactly the same example I kept using in negotiating these amendments. That again, sometimes it comes back, it's unsubstantiated, but that, civil and criminal liability can't come against us for doing what in best faith we followed our protocols. So thank you for that.
Do we have any other questions for Assemblywoman Miller or legal regarding the amendments? Seeing none, do I have a motion?
So moved, Black.
I have a motion to amend and do pass from Assemblywoman Black, and it looks like I have a second from Assemblywoman Benitez Thompson. And with that, do we have any comments or discussion on the motion?
Comment?
Go ahead, Assemblywoman Titus.
So I absolutely am going to support this and vote this out of committee with my right to change my vote if after I do, because again, I'm just kind of looking at these and having some questions. And again, I support it conceptually. I just want to make sure that the amendments haven't really changed any of that. So definitely I'm going to support it out of committee with the reserve my right.
Thank you. Do we have any other comments on the motion? Seeing none, Madam Secretary, can you please do a roll call vote?
Assemblywoman Benitez Thompson?
Yes.
Assemblywoman Black?
Yes.
Assemblywoman Gorlow?
Yes.
Assemblyman Hafen?
Yes.
Assemblywoman Krasner?
Yes.
Assemblyman Matthews?
Yes.
Assemblyman Orentlicker?
Yes.
Assemblywoman Peters?
Yes.
Assemblywoman Summers Armstrong?
Yes.
Assemblywoman Thomas?
Yes.
Assemblywoman Titus?
Yes.
Chair Wynn?
Yes. And the motion carries, and I will assign that floor statement to Assemblywoman Miller. If she's not available, I will give a backup to Assemblywoman Krasner. At this time, I'm going to end the work session, and we are going to travel back in time to unpause Assembly Bill 256. I know that we heard that presentation, and hopefully if Assemblywoman Summers Armstrong, if your computer is now working, if you want to conclude your presentation, you are more than welcome to do so now, or we can start taking questions, whatever is your pleasure.
Thank you, Chair Wynn. I am ready for questions from the committee if they are forthcoming. Thank you.
I have a couple questions up on deck, so I'm going to start with Assemblyman Matthews.
Yes, thank you, Madam Chair. Thank you, Assemblywoman, for the presentation on the bill. I was just wondering if you could tell us, have other states adopted this and have had provisions regarding this kind of coverage? And if so, if you could maybe speak to which of those states those may be. Thank you.
Thank you, Assemblyman Matthews. I will divert this question to the answer to this question to Quentin Savoy. I believe he is more than able to answer.
And I would just remind our speakers to please state your name before speaking, just so we have a clear record.
Absolutely. Thank you, Chair. Oh, yes, I'm unmuted. Okay. So to you, Chair Nguyen, through you, Chair Nguyen, to the Assemblyman. Assemblyman, yes, this has passed in nearly 24 states. This particular piece of legislation is actually modeled after what has transpired in Oregon. And since this has passed in Oregon, they have been able to see significant cost savings to the state and a reduction in cesarean deliveries. So yes, this is passed in other states. Different states have implemented different models, but this particular piece of legislation that we're trying to pass in Nevada is modeled behind what has happened in Oregon.
Thank you. Thank you, Madam Chair.
Thank you. Do you have any follow-up questions, Assemblyman Matthews?
No, thank you.
Okay. I also have Assemblywoman Titus.
Thank you, Madam Chair. Thank you for your personal story, Assemblywoman, for presenting this bill and sharing with us some of your personal events. It's always good to know how these bills get started and why. My question revolves around the CPT coding and wondered in these other states and Medicaid reimburses for this. And if so, the federal government is okay with that? And then I'll have follow-up questions.
Thank you, Assemblywoman Titus. Yes, that has been done in other states, and I do believe we have a representative from HHS who can speak to how that process works.
I think we have Mr. Young on the line. I saw him light up, so go ahead if you can answer that question.
Chair Gwen, through you to the Minority Leader, Assemblywoman Robin Titus. Dwayne Young, for the record, Deputy Administrator for the Division of Healthcare Financing and Policy. I don't have the specific CPT codes. There are a variety of CPT codes. Other states have set this up as either billing under the medical professional or a separate provider type. Much like community health workers, our thinking has evolved over the years. And so we would create this as a separate provider type and whose codes would be used in tandem with the supervising care physician.
Thank you for that follow-up question, Madam Chair.
Go ahead, Assemblywoman Titus.
So, and thank you for that, Mr. Young. Do you know, is there a set, is there like one fee for the services and you can start at 6 months prior to delivery, and does it follow for a year after? So what does that scope look like?
So the majority of the states that we've looked at have actually a bundled version of visits. And so we've looked at that analysis separately. We haven't really landed as to where we will actually go, if we will do those as separate visits or do one bundle payment for both prenatal and postnatal services. Ms. Lynch will testify a little bit later to some of the ideas that we have in policy, but we haven't landed on what that methodology, but most states do a bundled payment.
Thank you for that. Additional question, Madam Chair?
Go ahead, that's fine.
And so with obstetrics and delivery, it's one of the issues with OB and delivery. I, as a provider, literally delivered hundreds of babies, and the biggest risk for us is liability insurance and outcomes. So are they going to be mandated to have liability insurance under this practice? Who is going to be responsible for liability for bad outcomes?
Dwayne Young, Deputy Administrator for the record. I will do my best to answer this question. We may have to ask some of our friends at Division of Public and Behavioral Health. There is a provision in the bill language as it is written that Medicaid would be the regulatory authority. That's not something that we typically do. So we have spoken with Assemblywoman Summers-Armstrong about transferring that provision to DHHS as a whole. And so HCQC most likely would have that oversight. And then that would really be based on their practice model. Perhaps, Lauren or Alex could speak to that, how they carry liability insurance in their model now. But that would, I do not believe, would fall directly under the provision of DHHS.
And so would that be part of, will the DHHS establish like the scope of practice? I mean, are you going to be mandated that you do urinalysis for proteins and all of those other things, or who's going to be liable if they suspect preeclampsia and all of those things? I mean, who will set that scope of practice?
Dwayne Young, again, for the record. Assemblywoman Titus, the scope of practice will really be defined by the CPT codes for what they can bill Medicaid. Now, there will be certain provisions of the practice that will not be in billable CPT codes or not covered services, but those would not be reimbursed by Medicaid. And so those CPT codes are careful not to overstep or conflict with anything that the physician or APRN nurse midwife is doing, but they're very specific and defined.
Thank you. Thank you, Madam Chair, for allowing me all these questions.
No problem. And I think there might be someone on here that can clarify that these doulas are not, they're support advocates. They're not medical professionals or nurses. So,
thank you, Madam Chair, if I might
go ahead.
Thank you, Madam Chair. Chandra Summers Armstrong, Assembly District 6. If I could ask Lauren to speak to the scope. In the exhibits that we put in Nellis, there is a beautiful one with giving a side-by-side of what the role of the doula is. And I think that if Lauren, if you are still here, if you could please quickly speak to that.
I'd be happy to. This is Lauren Calagridis for the record. So like we said, doulas are not medical professionals. And so it is strictly out of scope for us to be doing anything like urinalysis for proteins, assessing for signs of preeclampsia. We don't, do blood pressure. We don't do cervical checks. No medical tests are within our role. It's really about the emotional support. It's about providing resources and referrals to extra care. So for example, if we notice a client reporting to us signs that could be, like swelling in their legs or feeling headaches or dizzy, we might say, you need to call your provider. This is something that's potentially risky and you need to assess with your provider. And so that's a little bit out of our scope of practice. It's strictly out of our scope of practice. I will say, as far as liability and coverage, is that many doulas do carry their own professional liability coverage. CMF is a common company that offers coverage for doulas independently. And that has more to do with things like, if they come to our office space for a prenatal, and they trip and fall, those kinds of things, but it's still not about medical birth outcomes. I hope that clarifies.
Can I have a follow-up on that, Madam Chair?
Go ahead, Assemblywoman Titus.
So thank you. So that brings up another question. So I appreciate that and thank you. Again, coaching and having somebody made my life easier if somebody was with the person in labor to coach them, and had that. Always recommended couples go get some education and birthing classes and all of that, and having somebody by your side, whether it's your best friend, your mom, your auntie, whatever, is always great. But then when you start hiring somebody that's now a professional coach, that's why I'm worried about that, the liability, and then that scope of practice. Because what's the consequences if that now person you hired doesn't do or recognize something and then or says something they shouldn't? Where's the consequences if they practice outside their scope of practice?
Thank you, Assemblywoman Titus. Alexandra, you are in this space on a regular basis. If you could speak to that, please.
Yeah, I actually, when Anthem sponsored us to provide doula coverage for the 50 of their members, I actually realized we had a gap in our code of conduct. And so I put together, and I can actually share my screen. I put together a code of conduct for the Reno Doula Project. So this is just an example of making sure people are staying within their scope under our association. So doulas are not covered under HIPAA, but I mentioned privacy is very important. We are not mandated reporters, but again, reporting is important. And then further down here, expectations of conduct. So we're reminding all of our doulas that we're not medical professionals. We are not to perform medical tasks. And even beyond that, if there is an emergency, we are responsible for calling 911. So if any doula in our association were to act outside of this, we have now processes to expel them from our association. I would hope that other doula associations with the reputation similar to what RDP has would follow a similar course of making these very clear, writing these out. And it wouldn't surprise me if under Medicaid, if we are a covered service, this would be required for more doulas to have agreements with associations and with Medicaid themselves.
Great. Thank you for that great information. Thank you. Thank you, Madam Chair.
Thank you. I have the next question up from Vice Chair Peters.
Thank you, Chair. And thank you so much for bringing this bill. I cannot tell you over the last 8 years as I had my 3 children and watched my friends have their children, how important this service, doula services, were to the well-being of the moms in those cases. Not everybody has a great relationship with their mom or their sister or their aunt or even has them left. And sometimes you just need that support. I know it was invaluable for me. I had my sister in my case, but I don't know what I would have done without that support in my 3 births. My question has to do with the kind of training standards that already exist. Doulas go through a process of learning how to be effective in the space that they offer services in. So can you talk a little bit about what those training standards look like and what the breadth of service that doulas use or are hired for can look like?
Thank you, Assemblywoman Peters. Alex, would you please speak to your scope there at the Reno Doula Center?
Yeah. So this is Alex Gutner. So there are a lot of training associations in existence because doulas are not regulated. The trainings themselves are not regulated, but they typically follow a similar format. So it's a multi-day workshop where we talk about what to cover during prenatals, how to stay within scope of practice during labor, how to act and conduct yourself during a hospital birth and during a home birth. Also knowing that we're not doing unassisted births, so there's always a medical professional there. And then also going over red flags for postpartum. When doulas first came about in the United States, again, it was very historically for the white and privileged. And so newer associations have created trainings that cover racial disparities. There are trainings by Black women, for Black women, and other women of color. And so now there are even more trainings available. So it would be hard to say only one training or only these trainings are acceptable. Certification is similar. So because doulas are not regulated, there's no way to know what a certification truly means. So again, making sure that whatever training association a doula is in at least covers scope of practice and at least covers certain aspects would be more important than making sure that each individual doula is certified or making sure that the trainings themselves are regulated. So again, there's a lot of work to be done in that area, but I have a lot of faith in the trainings that are in existence already.
I think that that's really important to talk about is that not every person needs exactly the same thing, and it's not like a math equation. It is really about those personal relationships, interviewing your provider for that service, just like any other service that you would ask for in the spectrum of your life. You know, it's not a one size fits all for everybody. And I think that that's really valuable to have in the community. My other question, though, was on the breadth of service. So I know from my pregnancies that postnatal care was very specific about the baby and about my health. The postpartum care was virtually non-existent. Can you talk a little bit about how you provide services both before, during, and after, and how that can be unique to each service scenario?
Sure. So a typical model of care would be 2 prenatal appointments, not including the interview. So an interview, 2 prenatal appointments, the birth itself, and then 1 postpartum visit. And it's 1 postpartum visit to a minimum. You can, of course, add more. The postpartum visit typically happens about a week or hopefully 2 weeks after the birth. Because doulas are not medically trained, and some of us are lactation professionals, but we're not all lactation professionals. Again, we're trained to notice red flags and to refer out. So a lot of times that friendship, that relationship that you create with your doula has them checking in on the mom more often via text message or phone conversations. But depending on what the mom wants, typically it is 1 postnatal visit, which happens usually before the postnatal visit with the obstetrician. So there is the ability to notice red flags before they would be seen in office by a medical professional, and then encouraged to go see their medical professional early.
So I think what's important about this conversation is that that doulas provide a unique and individualized service to people depending on what they need, to expecting parents depending on what they need, and that can be a wraparound service that's complementary to the medical health and medical providers services that are also regulated and taken into account and paid for through insurance processes during that birthing process. I think that's really important. One of the pieces that we, are kind of just starting to fully acknowledge in the birthing community is the importance of mental health, postnatal, mental health of moms and of the other parents. And without somebody who can identify that or is trained to identify that, it really leaves our populations vulnerable to those unexpected, senses of depression that I know from experience you don't always see from the inside. So thank you for bringing the bill. I really appreciate it.
Thank you. Next, I have a question from Assemblywoman Benitez-Thompson.
Thank you. I appreciate this. And I have to admit that I'm really naive as to what a doula is and what they do. And so I really appreciate this. This is really informational for me, and I'm learning a lot. So I guess I think I heard it said that right now doulas exist and that there's a certification process for them. So I guess I'm assuming then that the community self-regulates and the community self-identifies. Is that how that is right now?
Alex?
Yeah, I would say we do self-regulate, and it's fairly important to self-regulate because we can be, as individuals, kicked out of a hospital and said, do not come back as a doula. And we could also negatively impact the reputation of the association we're under. So again, we don't want any doulas from your association because you break rules, you do X, Y, Z. So it is very important that we are recognized as professionals and to not overstep. And of course, if we were to try to do a medical procedure, try to assess cervical dilation, tell the doctor they're wrong, or to stop in the middle of a medical procedure, we could be trespassed from the hospital and asked to leave. So we are very self-regulating to make sure that we don't ruin the reputation of those who are trying to do very important work.
Okay. As a follow-up question then, if it's okay, Madam Chairwoman, I was going to ask, so for example, I'm a licensed social worker, and this isn't calling for licensing, it's calling for registration. But for most folks where you'd have licensure, you're not allowed to represent yourself as being a member of the profession unless you are licensed such. So regardless of your education or, your master's degree or your trainings in something, unless you're licensed, you won't be able to represent yourself as such, nor hang out a shingle to say that you were such. So would you want the same intent for this registration, that if you were registered, then you have and met the requirements that the division puts out, then you would be able to represent yourself as a doula, but those who are not registered would not be able to?
I can see a situation where being a registered doula will be very important, but in terms of a certified doula, that really depends on the educational body you attended. So there's a lot of, for some associations, there's fees, yearly fees, certain follow-up continuing education that for some women, especially lower income women who are trying to make their living as a doula, can be prohibitory in remaining a certified doula. I personally never certified as a birth doula, and I consider myself to still be an expert in this area. So having registered doulas within the state of Nevada so that we can get reimbursement from Medicaid sounds completely reasonable. But in terms of requiring certification from the many different training bodies, I think that is because we're not regulated like a social worker, like a clinical psychologist, it does not look the same way. So I don't think it would have the same effects.
And Madam Chair, if I can just jump into piggyback. I'm sorry, I don't mean to interrupt Assemblywoman Benitez Thomas. I'm sorry.
Make sure you state your name, Quentin.
Sorry. Quentin Savoy for the record. I defer to the Assemblywoman Benitez Thompson. I'm sorry. Oh, okay. I can go. Okay. Well, I just wanted to add, again, Quentin Savoy for the record. I wanted to add to what Alex was saying. I want to be careful about the language that we're using, because I know that there has been a lot of conversation in the legislature about other reproductive justice. Senator Hammond has an addition to this. Moreno has an addition as well, where we're using licensure and phraseology like this. We're not talking about requiring these certified. What we are saying is that these required reimbursement, and as part of that, they would register with the office.
I'm sorry, Chair and Quentin. I'm having a really hard time understanding what you're saying. I don't know if it's the microphone or I'm just like missing most of what you said.
Okay.
I would have to agree too.
Madam Chair, if I may, Quentin, if you would turn off your camera, maybe that would help us because you might be having some issues with the internet.
Okay, let's try this now. Quentin Savoy for the record. Okay. Fantastic. I just wanted to be very clear about the language that we're using, that we are, as part of the registration, what we're saying is that we want doulas in the state to provide training, and we want them to provide documentation of training. And the training that Alex described, the multi-day training where they are taught how to identify things that would need to be escalated to a medical professional. But again, this is a non-medical role that's providing education, advocacy, emotional support, and all things that we would be doing for our friends, for our family, just in a dynamic where you are having to coach an expectant parent or mother through their pregnancy process. So I just wanted to be very clear about the language that we're using as to not confuse the intention of the bill.
And Madam Chair, if I might just interject another personal story. I had my last child in a hospital setting with folks who were certified and registered and had all the everythings surrounding, had a standard USA birth. And my youngest son was born healthy, we thought, and those folks who were certified and trained that were supposed to take care of me and him set us up in a room that was freezing cold, and he ended up in under a heat lamp for 6 days because he got hypothermia. So I think we need to make sure that we're not conflating these roles. This is a support person for the mom. She's not a medical professional, and we don't see anywhere any need for her to be, he or she to be certified, but registered, some type of a process set up so that there is training that is both culturally competent, that completely covers the scope of what we want birth doulas to do. We have amazing and intelligent women in our state who are in this space. And I think that they are more than able to work together with our government officials to come up with a scope of training that needs to be done so that they can do this work for moms. Thank you.
Thank you, Assemblywoman Summers Armstrong. Next up, we can go to Assemblywoman Krasner.
Oh, thank you, Chair Nguyen. And I think my question's probably for Ms. Gunter. You were talking about something about doulas being able to help with diagnosing postpartum or mental health. Could you expand a little on that, please?
Sure. So again, we're not qualified to give an assessment, but we can point women into the direction of assessments. So there's a few different, like the Edenberg postpartum depression scale, for example. We can say, why don't you fill this out? If you test in a particular way, it might be important to have a conversation with your provider about this. We are trained to recognize different types of perinatal mental health issues. And so if we do notice something, we are also able to point out, this isn't necessarily normal. Do you think you need help in this area? Or do you think perhaps getting in touch with a therapist or getting some group therapy, some support circles could help you in this area? So again, we're being very careful in our language when we speak to moms to not diagnose, to not say, it seems like you have depression. We can say, this isn't not necessarily normal. Postpartum depression is something that could be happening in the situation. Do you think that you might want to explore this more with a professional? So again, like staying within our scope has a lot to do with language and how we present things to moms, but definitely mental health is a component of what we focus on, both prenatally and postpartum.
I see Ms. Lauren has also unmuted. Go ahead if you have an answer to that question as well.
Yeah, I'd be happy to speak to that. That is the exact intersection of a lot of my work because I am a clinical social work intern. So I work as a perinatal psychotherapist treating clients with perinatal mood and anxiety disorders, like anxiety, depression, and also I work as a doula. And so the way that I might describe the difference between the two is that they're not diagnosing, but they're noticing red flags. And the beauty of a doula is that they're oftentimes in the home. Oftentimes they have access to partners. Sometimes clients will end up sharing things about their experience emotionally with their doula prior to being able to be vulnerable with a therapist. And so they're kind of getting some of like the insight information that all they really need to do is just notice like what's normal and what's not normal. And then in Reno, we've done a lot of work recently with Thrive Wellness, particularly in establishing really strong and swift referral systems between doulas, between RDP and Bright Heart and other doulas in the area with our mental health providers. And so, for example, if we see something escalating quite quickly, or if the doulas see something escalating quite quickly, they can reach out and say, we need some intervention, some mental health intervention swiftly. 20% of people will experience a perinatal mood and anxiety disorder, and that's quite underreported. So the quicker we can get into care, the better chance we have at intervening to protect the bonding and attachment experience between parents and children, because that is so crucial and can kind of escalate very swiftly into the number of ACE adverse childhood experiences that we see related to untreated perinatal mood and anxiety disorders. So I hope that spoke to sort of the bridge, but the distinction.
Assemblywoman Krasner, do you have any follow-up?
Just one follow-up. I thought that in the presentation they said that doulas aren't certified and some are registered and some aren't and some have the training and some don't. And if they're not all certified or all registered and they're not all receiving the same training, how do we know that they're able to spot these mental health issues or postpartum issues? Or maybe one just thinks it is and they make a report and it's false and the person's really not having a mental health issue. Or I don't know. It's a little.
Thank you, Assemblywoman Krasner. Lauren, would you please, you've worked both here and in New York in this space. Would you please speak to the scope of training that you've seen in both locales? Thank you.
Sure, I'd be happy to. Thank you. So as far as the scope of training, topics that are generally covered as sort of standard practice. So for example, DONA International is one of the largest doula training organizations in the country. It's one that oftentimes doesn't have, I've done some research on it in the last few years. And one of the downsides of an organization like that is that it oftentimes doesn't have the culturally humble lens and the culturally sensitive lens that is so rooted in community issues, particularly in terms of the maternal mortality crisis for women of color, things like that. But just because there's sort of like differences in topics reflected in the different training orgs. For example, in New York, I trained under the org called Ancient Song Doula Services. Ancient Song covered all of the same things as DONA International. So things like comfort measures, things like positions of the baby in uterus, things like education about common scenarios in labor and helping people think through what their birth preferences would be, basics of breastfeeding, things like that. And then in addition to all of those sort of standard core content areas, if you will, they also talked about the Black maternal mortality crisis in this country and the way that, sexual violence is, rates of sexual violence can show up to impact different communities, more. And so part of the specifics about kind of some states trying to not like narrow in and saying like, we need you to certify under this one doula training organization is that sometimes there's a risk of not meeting the whole needs of the community. And I think that's what folks were kind of speaking to earlier. As far as the piece around referring, like the risk of like referring someone who might not actually have a perinatal mood and anxiety disorder, I think I would just, it's about preventative care in a lot of ways too. And so there's actually not a detriment in the way that I see it as a mental health care professional, that if someone's getting to us, part of what our job is to do the assessment. It's not the doula's job. It's our job to say, do you need case management services? Do you need WIC? Do you need, outpatient therapy? Do you need intensive outpatient therapy? That's sort of with our scope of practice as a mental health professional. And we welcome people getting them to us, even if the person actually isn't sort of in a full-blown perinatal mood and anxiety disorder stage, if that makes sense.
Excuse me. Thank you, Madam Chair. And Assemblywoman Krasner, she's speaking about her role as a social worker, being able to do the diagnosis. That's her role. She's interested in encouraging the role that the doula, who has a relationship with that mom, to be able to see that there are issues that may need to be addressed, and to have that relationship built, that she can move her into the space of a healthcare professional to get them what they want, or what they need. I think we also need to remember too that when we were talking about the scope of the doula service, that doula is going to see that mom within the first or second week after the baby is born. Generally speaking, the post-birth appointment with the doctor is weeks out. And many things could happen as far as mental health or any other situation in between there. And that doula has access to that mom. They have a relationship. That doula can assess just, the differences. They have that type of core training, and now move that mom along to a professional so that they can intervene before it becomes a crisis. So thank you for the question, and I really appreciate that.
You know what? I'm going to move on to our next question. We have a question from Assemblyman Hafen.
Thank you, Madam Chair, and hopefully my question will be brief. I think we've had a really good discussion this afternoon. I know it was stated that there's approximately 24 other states that are doing this reimbursement. And you may not have this, but if you don't, could you provide us with a breakdown of which states are requiring the registered doula versus the certified doula? I'm just curious to see what the other states are doing in that regard. And again, I apologize. I wish I had thought of it beforehand. I could have asked for you to provide that information, but you could get back to me later. That would be awesome. I appreciate it. Thank you. And thank you, Madam Chair.
Thank you, Assemblyman Hafen. We will gather some data and get it out to the entire committee. Thank you.
If I could add, Quentin Savoy for the record, through you, Chair Wynn, to Assemblyman Hafen. We're happy to follow up with the entire committee with the information that you requested, Assemblyman. I want to clarify, though, that we're using a lot of terms, and I don't want the intention of the legislation to be confused. The registration that we're discussing is for the purposes of the Nevada State Medicaid Office, for purposes of accountability of how the funds are being spent. Okay, so registration as used with this legislation is just talking about registering with the Office of Medicaid within DHHS. Other states have set forth other provisions that have required doulas to be certified or licensed. That is not what we are proposing. There has been litany of research that has proved that when you create additional barriers to entry, it does lack cultural competency and the trainings associated to help Black and brown women and Native women. It proves that consistently across all of the studies. So again, I'm happy to research and follow up with the committee, but I want to make sure that we're using the proper terminology so that we're not confusing the intention of what we're hoping to accomplish with AB 256.
Thank you. And I have one last question from Vice Chair Peters.
I have a follow-up, please.
Go ahead, Assemblyman Haven. I'm sorry.
I just want to make sure that my question is very clear. In Section 1, subsection 1, we are actually directing the director to address the registered doulas. And so in there, it's very specific that this is for the registered doulas. And so my question is, what are other states doing? Are they doing the registered doula, or are they doing the certified doula? And that's the information that I'm requesting. And so thank you, Madam Chair, for the follow-up and the clarification on my question.
Thank you. And I'm sure Assemblywoman Summers Armstrong will get that information to Patrick Ashton, our committee policy analyst, and he will distribute it to the rest of the committee. And lastly, I'm going to go to Vice Chair Peters before we get started with testimony in support, opposition, and neutral.
Thank you, Chair. I really appreciate this conversation and discussion around the variety of services doulas provide and how that functions. I do think, though, that it's really important to acknowledge that doulas are hired to focus on the mom, and everyone else is focused on the baby, right? When you give birth, your obstetrician is focused on the baby's health and your body's health. They're focused on, you go to a pediatrician, they're focused on the baby's health. No, there's nobody who is exclusively there to focus on the mom's well-being. And I know as a mother of 3 kids, I was never asked in the first 3 days after my babies were born, how are you doing? It was always about the baby. And having a doula who is specifically there, hired by the mom to support her in those traumatic sometimes and vulnerable moments is so important for the health and well-being of both mom and baby in the long run. So I think that that's really important to clarify as well.
Thank you, Vice Chair Peters. At this time, I'm going to end questioning, and we are going to hear testimony in support, opposition, and neutral of Assembly Bill 256. I would remind our callers to please clearly state and spell your name for the record, and please limit your testimony to 2 minutes. Again, staff will be timing each speaker to ensure everyone is given a fair opportunity to speak. And so at this time, Broadcast Services, if we will begin testimony in support of Assembly Bill 256.
To testify in support of Assembly Bill 256, please press star 9 now to take your place in the queue. Would the caller with the last 3 digits, 917, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 917, please press star 6 to unmute.
Hello and good afternoon, Madam Chair and Committee. Thank you for the opportunity to present my testimony. My name is Ashley Dodson, spelled ASHLEYDODSON. I am a licensed social worker and representative of Make It Work, Nevada, in support of AB 256. I am also a Black mother of 5 children who have had several traumatic pregnancies and birthing experiences due to the lack of education, empathy during the birthing process, and care that I should have received during and after pregnancy. Lying on a table to give birth to a precious life can be mentally daunting when thoughts include, will I live and will my child live? Alongside the emotional and mental abuse to endure while being threatened by a white male doctor whom on the table with a cesarean section is told, if I don't hurry and push the baby out soon after 2 hours of me pushing and only receiving comfort from the nurse on duty, my fiance and mother. Had I had a doula, this most likely would have gone a different way. AB 256 is about our mothers and their children and ensuring they have a wholesome and healthy start in their life. Doulas play an essential role in providing care, support, and advocacy to mothers and birth parents before, during, and after the pregnancy. My personal experiences often left me advocating for myself, even during the most difficult part of the process to push and deliver the baby. As you can imagine, during that time, one is extremely exhausted and filled with anxiety. Statistics show that preterm birth rates for Black women are especially higher than that of their white.
Caller, you seem to have pressed the mute button on your phone. You are clear on our end, but we can't hear you anymore.
Hello?
We can hear you.
Okay, thank you. AB 256 is the start of improving birth outcomes for mothers and birth parents in Nevada. This bill is community-driven public policy that tackles the racial and reproductive injustices that Black women and other communities of color face. In states that have passed legislation similar to AB 256, they've shown cost savings to the state by reducing the amount to C-section births, as well as birth parents reported improved birth outcomes and overall experiences. In conclusion, again, as a Black mother first and foremost, I urge the committee to support and pass AB 256. Thank you for your time.
Thank you. We can go to the next caller and support broadcast services.
Caller with the last three digits, 039. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is Erica Minaberry. That's ErikaMinaberry, and I am testifying in support of AB 256. I became a birth doula in 2015 after experiencing 3 traumatic births myself. My first birth ended in a cesarean section because I did not know what my rights were as a patient, and I did not know what to expect in labor. Those 2 factors not only led to my cesarean birth, but also led to massive struggles in breastfeeding, postpartum depression, and 6 scar adhesions growing in my abdomen that need to be scraped out in a major abdominal surgery before they grow to the point of cutting off circulation to my organs. Medicaid will be covering that surgery. I became a doula because if I had a doula support during my first birth, I would have been able to avoid the multiple costly health issues that were born from my ignorance in the labor process. Doulas provide that information as one of the core competencies of our work. My story is not unique. The informational, physical, and emotional support that we are trained to provide statistically improve birth outcomes, mental health, and save money. Considering the abysmal statistics America has in maternal and infant mortality, providing doula support for families makes sense both morally and economically. On behalf of struggling new parents, too overwhelmed to testify, for all the parents who are mourning the loss of their babies, and for the babies who are mourning the loss of their parent, I implore you to please vote yes on AB 256. Thank you.
Thank you for your testimony. We can go to our next caller and support.
Caller with the last 3 digits, 422. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair and members of the committee. For the record, my name is Tiara Moore. That's Tiara Moore, Moore. I am the Housing Justice Organizer with Progressive Leadership Alliance of Nevada, here in support of Senate Bill 256. As a mother of 6, I had a doula with my last child. Doulas are not only important for to be part of just the healthcare system, but also a part of the child's life as well. My last child, which is my 1-year-old, we had a doula throughout our pregnancy, and I received very good care. And because of my doula, I was able to fully recover. My baby was very healthy. Doulas are an effective part of the healthcare system. The cultural competence of doulas are to provide support and care, to provide, during the birth and outcome of women. The data show that doulas assisted mothers throughout, are 4 times more likely to have low birth weight babies, 2 times less likely to experience birth complications involving themselves and their babies, less likely to receive cesarean sections, and it just helps with the breastfeeding process as well. They are there to support. And with my 6th child, I was able to have that support. And with my 7th, I plan on having the support as well. Medicaid coverage for doulas will ensure that the future Nevadians, regardless of their family's economic status, are born with the best possible outcomes. And I encourage you to support Senate Bill 256. Thank you.
Thank you for your support. If we can go to our next caller in support.
Caller with the last 3 digits, 817. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is LaShonda Marv, Austin, LASHONDA, Marv, MARVE, Austin, AUSTIN. I'm organizer here at Make It Work Nevada. More importantly, a Black mother of 3. I'm in support of AB 256 because I lost 9 children before giving birth to the 2 that I have now. If I had that support, then I think that I would have known what questions that I could have asked. They would have been able to recognize things that were not correct. And I also had an issue with my 3-year-old. I did not receive any postpartum care here in Nevada, and I was distressed and I wasn't able to care for my child. I was threatened with my kids being removed from my home because I wasn't able to properly care for them because my mental capacity was not where it needed to be. After reaching out to my healthcare providers multiple times asking for a prenatal appointment, with them responding that they were simply overbooked. Had a doula been available, she could have been there to advocate for me and also support me when I was falling and about to lose my children. So I am in full support of AB 256, and I am ready for a change. Thank you.
Thank you for your testimony. We can go to our next caller in support.
If you have recently joined the call and would like to testify in support of Assembly Bill 256, please press *9 now to join the queue. Caller with the last 3 digits, 020. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is Tara Raines, T-A-R-A, Raines, R-A-I-N-E-S. Thank you so much for the opportunity to speak in support of AB 256. I'm speaking first in my capacity as a Black mother. I was fortunate to be able to afford doula care when delivering my daughters. Given what I knew about the Black maternal health crisis and the outcomes, it was important to me that a Black woman was present at my birth to advocate on my behalf. For me, her support was invaluable. She assisted us in preparing our home for my daughter before I delivered. She prepared me and my partner for what labor and delivery could look like, and she really helped set our expectations for what those first few days of our little one might bring. She was a pillar of strength as I labored, and she offered support both to me and also my partner during the long hours before our delivery. After my birth, my doula came to the home to help us with tasks ranging from prepping meals to swaddling the baby to helping me figure out how to use the new Moby wrap carrier that I really struggled with in those early days. This support should be available to every birthing person who wants it. The presence we know of doulas reduces mental health crises after birth, and it increases breastfeeding, which is important both to bonding, but also has long-term nutrition and health outcomes. I implore you to please, please, please pass this bill as we in Nevada need this support. Thank you.
Thank you. If we can go to our next caller in support.
With the caller with the last 3 digits, 874, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. For the record, my name is Cristina Hernandez, C-R-I-S-T-I-N-A, Hernandez, H-E-R-N-A-N-D-E-Z, and I'm here in support of AB 256. I've been a birth worker doula since 2016 in Las Vegas. During my tenure, I've seen the impact doulas provide. Just last year, a local group of us were able to provide doula services via grant funding to victims survivors of sexual assault and domestic violence. We were able to see firsthand what we already knew. Then it made a significant difference on the birth experiences and during the postpartum process for our clients. Having a doula is not a luxury, it is a necessity and one that all birthing people should have access to. In closing, I also ask that you ensure you pay doulas a living wage and make language inclusive of all birthing people, since not all birthing people identify as women. Thank you, and I hope you pass this bill.
We can go to our next caller in support.
Caller with the last three digits, 601. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, my name is Maya Bennett. MIAYABENNETT. I am a Black mother advocating for this doula bill, AB 256. I have 2 children, 2 young children, 3 and 2 years old. I myself had a doula, but I know the importance of needing a doula because I know people who didn't have it, and on my journey of learning about what it is to be a mother, to have a child, everything that you need to know before the baby comes. My doula was able to help me with that. I was able to take classes. I was able to learn about the truth and the myths about labor, about birth, about the child, about the expectancy of the baby and what is to come. And I feel like it's very important. I know that with my first child, we had a lot of, I had preeclampsia, so I had to have a emergency C-section, and it was very scary. And if I didn't have my doula there to explain what preeclampsia was and exactly, and make me feel better, my doctors were very just straightforward. They didn't care emotionally about me and how I was going to take the news because I had a birth plan and because I assumed my pregnancy would go the way I wanted to go, and I was planning for a particular way. My doula was the only person who was able to make me understand what was the safest for myself and for my child, why it was the safest for myself and my child. They gave me the information that I needed to educate me about what exactly I was going through and what I needed to do. I know that I was working to have a home birth with my son, and I didn't get to have that home birth. So I was, blessed enough to be able to pay for all of the midwifery clinic needs. And then when I went to the hospital, I wasn't treated as a patient of the hospital because I didn't have a specific doctor. I was using the doctor that was assigned to me through that hospital.
I'm sorry, ma'am. Can I get you to, excuse me, can I get you to wrap up your testimony? You're right at 2 minutes.
Okay, no problem. I just think it's very important to have a doula because they are able to help you learn the things that you don't know and the things you need to know to be comfortable and just for your own mental health. Thank you.
Thank you. And at this time, we've been going for 15 minutes, and I want to make sure I allocate enough time for neutral and opposition testimony. If you are still on the line and you want to present written testimony in support of this bill, please do so in writing. You can do so up to 48 hours after the conclusion of this hearing, and I would encourage you to do that. I think sharing those stories, and again, I know our committee members do review those documentation. At this time, if we could go ahead and go to any callers in opposition of this bill, broadcast services.
To testify in opposition to Assembly Bill 256, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Do we have any callers in neutral at the time? And I'm going to look first at the Zoom. Do we have anyone in neutral on this bill that is on the Zoom that wants to present neutral testimony? If you do, if you could unmute yourself right now. Seeing none, if we could go to the callers on the line, if there's anyone in neutral.
To testify in neutral to Assembly Bill 256, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 786. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. My name is Erin Lynch.
Erin, E-R-I-N, Lynch, L-Y-N-C-H, and I'm the Chief over the Medical Programs Unit at the Division of Healthcare Financing and Policy. So for AB 256, the division has estimated a cost savings in covering doula services as part of the Nevada Medicaid state plans. So this means that the benefits of covering doula services far outweigh the cost of reimbursing doulas for their services. And many studies have shown that doulas can assist in reducing preterm birth, number of low birth weight babies, morbidity, mortality rates, NICU admissions, depression, and anxiety. And then also these studies have also shown us that doulas can also assist with improving outcomes for mothers and babies, with reduced cesarean rates by providing labor support towards the vaginal birth, decreased use of pain relief medications, increased breastfeeding rates. So all of these outcomes help improve healthcare outcomes, lower healthcare costs, increase quality of care, and even reduce healthcare disparities. So Nevada Medicaid utilized many doula studies and the cost savings to Medicaid programs. And reviewing all of these, our analysis used the cost-saving methodologies in these studies to determine that there would be a cost savings to Nevada Medicaid if we reimburse doulas for their services. So overall, I'm just really pleased to say that our analysis resulted in a cost savings of over $1.2 million. So that includes the medical side of our savings, and then also our system costs of like having to create maybe a new provider type and mapping codes. But overall, it would be a cost savings. So additionally, like Mr. Young had already stated, that the division is also working with the bill sponsor on the portion of the bill regarding oversight or registration of doulas. So we're looking at how to figure that out. And then also, I just wanted to help answer the question on CPT codes that would be billed. So even though we have not developed the policy and CPT codes to be billed, like other states like Oregon who have doulas, they have them bill their Medicaid program based upon the type of delivery. So like whether it was a vaginal delivery, vaginal which turned into a cesarean, or vaginal after a previous cesarean, all of those have different CPT codes. And that would allow like that Medicaid program to tie the doula to the type of birth that actually occurred. So even though it would have the same type of reimbursement, it helps tie the service provided to the outcome. So overall, that ends my testimony in neutral for the division for AB 256.
And Ms. Lynch, can I go ahead and have you stay on the line? I know that you were there to provide neutral testimony, cost neutral. Actually, it seems like cost savings pretty substantially. But I know that there had been questions from committee members regarding that. Does anyone have any follow-up questions for Ms. Lynch, since she obviously may have some of those answers, or it sounds like she may have answered some of that in her neutral testimony.
If I might, Madam Chair?
Go ahead, Assemblywoman Titus.
So you just testified that you are estimating a $1.2 million savings based on national data, or are you using Nevada data? Because we already have doulas here. Do you have any studies done in the state of Nevada, so relevant to our state? Because it sounds like we have a significant population of doulas already that are involved in the process. So have you any data related to Nevada on cost savings, number one? And number two, do you have a fixed number on what you would pay a doula? It sounds to me like if they had bad outcomes, they'd get paid more. Like if they ended up with a C-section, you're now going to stratify that and pay them more. I'm just curious on where you got your figures.
Thank you for the question. This is Erin Lynch for the record. And so we looked at national studies on Medicaid and then applied those cost savings using Nevada Medicaid data. So if it said that the national study helped reduce Medicaid costs by like $1,500 per birth. Then we applied that to the number of births that occur in Nevada. Also, national studies say that only about 6% of births are attended by doulas. So again, we applied that type of percentage too. So it's kind of like both. We're using national studies and then applying it to Nevada Medicaid data.
So am I
Does that help answer that question?
Go ahead, Assemblywoman Titus.
Yeah. So now I hate to belabor this, but now you're bringing up another question. Was this studies done, and maybe you could give this out to the group, were these studies done using a doula versus a coach? Because certainly if you have a loved one, a parent, or a coach there versus nobody at all, or were these, I mean, I always worry about, well, we have studies to show this, but what's the end number and how many did it really serve? So I really researched this before this testimony today, trying to find some of that actual factual double-blind studies and the end numbers and all of that. So if you have that, I'd love to see that stuff.
If I can
I'd have to go back and relook at these.
Ms. Lynch,
Erin Lynch for
you know, obviously we put you on the spot. Sorry. If you could provide that information to Assemblywoman Titus, obviously you can look at it. You know, obviously with the data collection is premature at this time, and I get that you are trying to, you know, use some of those national statistics as well as try to incorporate it. So if you could get whatever you have to the committee, that would be helpful, I think.
Thank you.
Absolutely.
Thank you. Do we have any other follow-up questions?
And
go ahead.
This is Erin Lynch. There was a question about the reimbursement. So the analysis that we conducted was mostly based upon other states such as Oregon. And Oregon reimburses a bundled rate. And for example, their rate is $350, no matter what the outcome is, whether it's a vaginal birth, cesarean birth, it's a $350 reimbursement rate.
Thank you for that. And again, if you have any other follow-up information, I'm sure it would be very helpful for the committee members here to be able to review. And do we have any, and thank you, Ms. Lynch, for staying on the line and answering those questions. Broadcast services, do we have anyone else on neutral?
Chair, there are no other callers in neutral at this time.
Thank you. And at this time, I will turn it back over to Assemblywoman Summers Armstrong to make any closing remarks.
Thank you, Chair Wynn and committee. I truly appreciate you and the members of the Health and Human Services Committee for listening attentively and asking such pointed and deep questions. I would refer all of the members to Nellis. There are a number of exhibits from the March of Dimes, the Nevada Department of Health and Human Services, and even an excerpt from the National Vital Statistics System. These reports paint a stark picture of maternal death in our great state. This bill allows us to improve these statistics by focusing on moms. When moms do better, babies do better, and families do better. I'm going to conclude, try again with this screen share. So here we go. Let's see if we can get it right this time. You see it. Okay. I'm not going to touch it. I'm just going to let you look at it. In conclusion, I didn't want to do this. This is Fabusa. Doulas and birth support people are not, they are important. This woman helped me birth 2 beautiful sons in a foreign land, 5,000 miles from my mother. The first picture is of she and I in 1987 when she helped me birth my son, Brandon. I was just a kid. And the second picture is she and I in 2013. My husband and I, we took a trip to Europe, and on our trip, we took a side trip to see Frau Busse. That is she and I in her garden in Kloppenburg, Norderdeutschland. This woman loved on me when I needed her to. She cared for me when I needed someone to care for me. She wrapped me in her arms of love. She supported me. She saw me. She was a doula and she was a midwife for me. I was lucky that I had her, and I'm asking that this committee consider that every mother in the state of Nevada is worth it. And I hope that you will support this bill. Thank you.
Thank you, Assemblywoman Summers Armstrong, for your presentation. At this time, I will close the hearing on Assembly Bill 256, and we will begin public comment. As a reminder to the public commenters, please clearly state and spell your name for the record and limit your comments to 2 minutes. Again, we will be timing to ensure everyone is given a fair opportunity to speak. Broadcast Services, do we have anyone in public comment?
To participate in public comment, please press star 9 now to take your place in the queue. Chair, the public line is open and working, but there are no callers for public comment at this time.
Well, thank you for that. Are there any comments from members before we adjourn today? Seeing none, this concludes our meeting for today. We're still working on agendas for Friday, Monday, Wednesday, and Friday of next week. As you know, we received a bunch of bill introductions to Health and Human Services. And we are just looking at scheduling those. Obviously, we have a short period of time, so we're going to be hearing a lot of bills here. So please keep a check on your email as we get those agendas prepared and we get bills scheduled for hearings. So at this time, this concludes our meeting for today. The meeting is adjourned.
Thank you, Madam